All right. Well, good morning, everyone, and welcome to our twice monthly uh, WebEx chat. Opportunity for the county officials to connect with MACO and with the local government center to talk about pressing issues. We have been historically talking about COVID-19 reimbursement from the CARES Act, and we can continue having that discussion. I'd like to thank everyone for participating. We hope this is valuable to you. We have 38 people on the call right now, and so we extend our great gratitude to you for participating. For those of you that do not know who I am, my name is Dan Clark, and I am the director of the Local Government Center at Montana State University. We're housed under the umbrella of Extension. And so we work with local governments across the state, providing technical assistance, research, and training to city, county, and special districts. So that's who Ashley and I are. We've been hosting these sessions for, I think, since probably June, sometime. We're pleased to be in partnership with MACO in offering these sessions for you. They're a wealth of knowledge. They're down in the trenches representing you both in Helena and Washington, D.C., trying to make sure that your interests are being recognized by those and decision makers in the city at the state and federal level. So with that, Jason, is Eric on the call too? I thought I saw.
He is, but he's fighting a cold, so I think he's going to stay in the background. And I think we got Mackenzie on if we need her. So if questions come up that I can answer, we'll call on them.
Great. Well, if there's nothing else, then I think we'll just kick it over to Jason for Mako and let you start the ball.
Okay, I'll start with some good news. Given that we're nearing the end of a cycle and everybody's probably starting to look forward to getting ready for their next submittal, the questions and email traffic has slowed some. Given that, I'm hoping that we can give you a little bit of your Friday back and keep this fairly short. I don't want to recap all of the presumptively eligible employees, et cetera, this time. We'll save that for when we get close to the next submittal, if we need to revisit that. If you have any one-off questions on those, just drop me a note and I'm happy to answer them. If any of your counties are having internal discussions and aren't sure what to do and you can't get everybody on one of these town halls, I'm happy to also do a one-on-one with your county. So keep that in mind. We've done a couple of those. We continue to have our weekly meetings with the governor's budget office. We try to do them in person when we can manage it, and if we don't do that, we call in. But we are staying in constant contact with them. I know that I have a few of you out there that we still have requests in that we're still debating with them on. Ravalli County has one. Butte Silver Bow, I think, has a couple. Park County has a few requests in. If any of outside of those, if you haven't heard back from me, my list of outstanding items has shrunk considerably. If you think I should have something from you on my outstanding list, please drop me another note and remind me. I've tried to keep good track of those, but sometimes things get lost in the shuffle. A couple of quick reminders: case management systems for your county attorneys. We've had probably a dozen county attorneys' offices step forward and are moving forward with implementation of their case management systems. These we've got pre-authorized. The caveat is they have to be installed, usable, billed, and paid for by the end of the year. So they have to be able to use them by the end of the year. You need to get an invoice and get them paid for. Same thing goes for digitization of records. We've got sort of a blanket pre-approval. They do want me to ask for costs and give the thumbs up, but we have some latitude there for MACO to give those pre-approvals so we can turn those around. If you need to digitize your records so that they can be indexed and available to your public, same thing. If you can do it, you can get a vendor to get it installed, operational and usable by the end of the year with an invoice and a payment. We've got sort of a pre-authorization on those. We did a town hall with the conservation districts. So those of you that are at the local level, especially the clerk and recorders, expect that if your conservation district has some expenses or anticipates some expenses that would be CARES eligible, that they will be reaching out to you. I've asked them to do that from the standpoint of, I want you to tell them what you would want from them as the submittal and when you would want it, so that it doesn't add stress to you gathering all of your information. They are asking for pre-approvals for some things, but if they submit through you and something is denied, D of A has indicated that they will, in their response to you showing how much they're paying, will tell you if they've denied any special district expenses, so that you know not to pay those out. If you have any issues with any of the special districts coming through you, questions, please reach out to me. One new development from yesterday's call: detention centers. For those of you with detention centers, if you have an inmate or inmates who get COVID, who get sick from COVID, and you have medical expenses on that detainee, you need to track it one of two ways. One is, if they're a state hold, track their expenses that way, and we'll submit that to the state for reimbursement. If they're a county hold, put it in your reimbursement request for your county. So they are going to reimburse detainees COVID-related medical expenses should you incur them. So that was a new one that I hadn't thought of, that we had a conversation about yesterday and decided that that would be an eligible COVID-related CARES Act eligible expense. Pre-authorizations, still get a fairly steady stream of those. We work through them as quickly as we can. I have seen an uptick from quite a few on what I would consider incidental costs. If you're looking at some sort of PPE or cleaning supplies that are directly COVID related that you wouldn't buy otherwise, I think you're fairly safe to just purchase those and submit for them. We don't need to get caught up in super small requests for, a small batch of masks or special cleaning supplies. Just go ahead and get those, submit them in your reimbursement. If they deny them, please let me know. I will go to the mat for you on those. But those pre-auths, I'd like to sort of hold for the bigger ticket items that we can really dig in and fight for. The last thing is, so those of you that know me a little bit know I like to escape for a little bit in November, and really as we work through the rest of this, I would ask that if you make a request of either me or Eric, that you copy the other one on that request so that we can get back to you timely. I will be checking emails when I'm gone, but probably only once a day. With that, I would open to questions and any additional comments if I've missed anything, Eric.
Give Eric a second, see if he wants to jump in, and then we will go over to the chat here.
No, he's all good. Take questions.
Good. Okay, great. First, we have, looks like 3 questions in right now. The first one is March 12th through June 30 costs submitted in the 3rd or 4th CRF rounds. Those reported on FY 2020 or FY 2021. I understand the case for either, but coordinated revenue recognition treatment for like circumstances will hold up to single audits a little better. It also depends on which year DOA will report the payments. Do you have any thoughts on that?
So my initial reaction is to reach out and ask your auditor how they would prefer you to book that in. Given that most of you probably have already done your audits and probably closed the books on last year, that makes it a little tricky. If we were back in June, I would have told you to book it for last year. So my inclination is you would book those costs for last year, if you can. But ask your auditor if you have them available.
Okay. So we have kind of a follow-up that just came in on that too. So can we get some help on debating with our auditors on how costs should be reported? How auditors want us to reclass all expense requests requested by class to Fund 2999 instead of where the funds were expended from? You see that question in there?
No.
And another kind of follow-up, has anyone undergone an FY 2020 single audit for CRF funds yet?
I have not heard of anybody going through an audit, but maybe somebody on here has.
Ashley, can we get Keith to maybe unmute and have a little fuller discussion about what that is? I think what I understand the question to me is that the auditors want you to go back and trace expenditures, not from the expenditure fund, but into that revenue fund that you're receiving the restricted dollars back into. And if that's the case, I want to help argue for him.
Okay.
I'm
Keith,
sorry, that was actually Scott's question. So maybe we can address that from Scott first.
Scott, are you on and able to unmute? Or is he the one that, he doesn't have a mic today. So he's unable to. So maybe, Eric, would it be helpful if he called you guys and had a little bit more of a detailed discussion?
Yeah, but this, I think it gets to the root of something that we've been working with really since early on in the CARES Act, and that's to be able to get the money back in, receipt it in, and get it in one way, shape, or form back into the county's general fund to be used for general governmental purposes. The bulk of the money that counties are going to get back, and cities actually for that matter, is going to be the presumptively eligible personnel expenses for those sworn law enforcement detention and 911. And if the auditors preliminarily were correct in believing that these were grants and that the grants had to then be coded back and credited back to the expenditure fund, you're going to run into issues of all kinds across the board, from having too much cash carryover from year to year to doing budget amendments to having that money come back in a restricted fashion. And Treasury and the Inspector General at the federal level have clearly and consistently clarified that these aren't grants. They are subject to Single Audit Act requirements, but they're not grants in the traditional sense that grants are, which would then make them restricted. So if your auditors are saying, you know, the state has told you to set up that special revenue account so it can, the money coming in can have that federal identifier, and then you can bill against that, which is sort of the stopgap between having to have the money come back into the expenditure fund, and then hold it till we get further clarity either from the feds or from the independent auditors in the state so you can transfer back to your general fund unless you need the money right away. We're still at this impasse, this standstill. I think we have the state local government services bureau folks understanding, and if we can't get our auditors or additional clearance from the feds, in my opinion, the worst case that you'll have is what I consider to be fairly insignificant audit findings one time about an auditor's perspective about how you should have allocated the money coming back in versus what you did when the money came back in. It's not going to be a misappropriation. It's not going to be anything other than what I consider to be a technical finding. If that's the case and you want to live with it, fine. If your auditors are going to be persistent in saying you needed to get back into the expenditure fund, that's a decision you guys, commissioners, can make, knowing the consequences of what would happen if you don't. We're just not there yet.
So, and I would just follow up with the state made this a reimbursement program, not the feds. And so to reclassify an expense indicates it's a reimbursement from the feds, and that's not what the dollars are. And there's no contract with the county. This is not a grant agreement where you've agreed to reimburse those funds. These are, they're trying to make this fit into a box that's a normal box, and that's not what CARES Act is. So they're trying to make their handling of the dollars fit what they're familiar with, and we disagree with that. So as far as our stance is those dollars go into 2999 revenue fund. There really is, other than a transfer out into another fund, not in my eye, an expense directly tied to that. Correct me if you disagree, Eric.
No, I think on that we agree.
Okay, great. All right, let's look at the next question. So Jason, back to your information about that software for the county attorneys. Does the county attorney software have to be installed and operating parallel, or does all of the data conversion have to be completed by December 30 as well?
if you're a county attorney, the system has to be installed. And if you needed to do a case through that system, you need to be able, it needs to be operational that you could do a case through that system.
Okay. Okay.
That's as lenient as I can get on that response.
Okay.
Okay.
What about this one from Paula? Would setting up our clerk and recorder recorded document database to be available to be viewed and purchased on the internet qualify for COVID funds?
I'm not sure I understand what that is.
Paula, are you on and able to unmute? Let's see. You are unmuted, Paula, if you're able to talk.
Okay. So my Tyler DocuPro database, we just have where we record all of our documents, enter everything that's recorded, everything that's filed. We do not have that available on to be viewed on the internet. A lot of counties, you can look up their tax statements, their tax records for title companies, lawyers, mortgage companies, anybody that needs to look up, they have to come to my office and look it up, view it, print it off, pay for it, and then be on their way. I didn't know if we put it, and Tyler has what's called iDoc that would be able to. They would just get a password, log in, give them their credit card. They could get any document that they needed to without having to come physically to our courthouse.
So my short answer would be, I think so. What I would want is a cost on that and a short paragraph or two narrative that what you just said about not having to come in, mitigate the spread, etc., and shoot that to me and I will respond accordingly.
Perfect. I just happen to have a quote. Thank you.
Okay. I have not heard of anybody getting a single audit on CRF. CARES Act award letters. There is no such thing that I'm aware of.
So
That gets back to the point of it's not a grant. There is no grant agreement. There is no contract between you and the state on how you're going to spend the money. They do the vetting of your expenses to make sure they're CARES Act eligible, and they hand you the money as a eligible expenditure of their funds that they were given from the feds.
okay. So if you have, sounds like there's auditors asking for those award letters, and you're saying they will not be issuing any kind of award letter because that's not the type of funding it is.
It's not a grant. There's
Okay.
no award.
Okay. All right. I'm trying to catch up here.
Let's dig into that just a little bit better.
Okay.
In essence, what the state is doing is paying some of your bills. There's no grant application. They are simply taking guidance on the $1.25 billion that they got. They're taking that guidance and they're applying it to how they distribute those dollars to a number of different types of organizations, local government being one of them. So there is no agreement in nearly every instance between the state and the subrecipient. There are some with some of the nonprofits, but basically, once those dollars are authorized to go out because they fit within the CARES guidance, that's the end of the transaction.
All right. How about this is a little bit of a change of gears. Our district court is using the county-owned community center and is being charged a rental rate. The need is caused by COVID compliance issues. Will this qualify as eligible cost?
I say yes.
Yes.
Okay.
So the key there will be the documentation.
Okay. And then
Jason,
another question. Go ahead.
Jason, I'm pretty sure we've had applicants in previous cycles submit and be reimbursed for costs incurred for renting the facility for themselves for special purposes. I can think of a couple fairgrounds that were overflow or for testing or things like that. So renting facilities that the county owns for COVID-19 responses, like a district court, incurred cost absolutely is an eligible and reimbursable expense if it's reasonable.
Reasonable, and they have some sort of documentation of the rental agreement, right?
Okay, great. I have another question here. Are software licenses purchased for a term of 3 years covered, or would the amount be allocated from now through December 30th?
Is it a fee based, or is it you buy it and you just get 3 years? So I'll expand. If there's an annual fee attached to something, they're prorating through the end of the year, and then you would be responsible for the rest of the year.
Okay.
If it's included with the package, and you would pay that no matter what, then they probably are going to pay it 100%.
It says annual fee.
Yeah, they're going to prorate it through December, and you're going to pick up the difference.
Okay. Okay. I think that gets us caught up in the chat for a minute. Let me look at we have no hands up. So if we have any other questions, now's the time to throw them in there. Here's one. Has there been any resolution of funding having to go back to public safety versus staying in the COVID fund?
That gets back to our earlier conversation about still debating with the auditors. No.
Okay.
We have and I think the question about an auditor asking for a grant award letter illustrates the difference between the way we view these dollars and the way they're viewing these dollars. I couldn't have said it any better than that question says it.
All right. How about, I would be interested in the county attorney software that is not annual licensing. Can you please give me the vendor?
So it's Carpal, and there is an annual fee on that, but the upfront setup is being covered. The annual fee your county will be responsible for going forward.
Okay, so thank you. All right. Any other questions or thoughts, either in the chat or raise your hand? We'll watch here for a second. In the interim, Jason, Eric, or Dan, is there anything else that you guys would like to cover? Well, we got everybody on the line.
Hey, Jason, this is Roman.
Hey, Roman.
So how about the example of, say, Mineral County Health Department needs a new vehicle travel for the nurses, so they don't have to do their own mileage, et cetera, when they turn in travel and all that. So if we were to purchase a new vehicle for the health department, how much of that would be reimbursable?
So we would have to find the nexus as to why you needed that and how it relates directly to the onset of COVID.
Okay.
We with any of those types of purchases, we have to, I mean, COVID has to be the reason you're buying it, not saving mileage dollars.
Right. Okay.
So we would have to put our thinking hats on and see if we could come up with a nexus and then make the ask. That would be something I'd want to try and run through a pre-approval.
Would it be kind of would the pre-approval require, would it end up being some kind of a prorated deal then? So if we had to hire 3 new nurses due to contact tracing, and these 3 new nurses had to do some travel, then probably the $25,000 car would only be prorated and reimbursed if it was accepted.
So if you had to hire 3 new nurses as a result of COVID, the nurses' pay would be covered. And if for them to do their job, because now you've got 3 additional staff, you needed to buy a vehicle for them to use, I would argue for 100% of that to be eligible.
Okay, and then I just quickly saw Eric Bryson wrote a note, but Eric, I didn't get to read it all. So did you want to comment? And
Yeah, Commissioner, this falls into one of the frustrations we've had with the governor's budget office. They're reluctant to be able to authorize purchases for things that have some sense of permanency. There's a bunch of different examples out there. I think counties have requested things like foldable chairs for additional space to accommodate public and meetings that are socially distanced. And the state's balked at those because they say, you know, it's not a temporary solution. They have rejected remodel proposals based on some sense of permanency, that there would be cheaper alternatives that would be more temporary because they believe that these COVID funds should be used to alleviate what's going on in this pandemic. I think a car would fall under that same discussion with them, and we'd fight like heck, but I think at best you just get a small portion. You'd get a prorated portion of what they would probably depreciate the vehicle over 5 years. You get 2 months of 1 year of depreciation, would be my guess, is how they'd ultimately end up doing that.
Okay, thank you.
I don't like to disagree with Eric, but I think if you had to hire additional employees, which would require a piece of equipment, I think it changes the argument a little bit. So I'd like to take a swing at that, Mr. Bryson.
Hey, Jason or Eric, this is Joanne and Rosebud. Do you guys know if, like, is December 31st the drop dead date as far as, so this fund they're not going to be available after January? I'm just kind of, someone said that this will probably continue for a while, and I just didn't know what your comments about that were.
So as of today, December 30th, expenses incurred and paid through December 30th. That's it. That's our deadline. Without congressional action, that's what we're facing. So our last reimbursement request will be asked for in January for all expenses incurred through December 30. Not 31 even, 30.
Okay. All right. Thank you. I was just making sure. I just didn't know if we'd have all the money spent by then and they'd continue, or whether they're going to do something else with the money, I suppose.
We obviously have a pretty significant fear that there will be money left on the table. We're doing our best to try and figure out ways to make that not happen. Ultimately, it's, the state's responsibility to get that distributed best they can. And we are also, through NACO, advocating for an extension to make sure we have additional time. And COVID's not going away. The expenses you're incurring are not going away. We have valid arguments for that, but as you know, nationally, the scene changes considerably between Montana and other states, and there are some folks that would like to claw back some money on the other side of the nation. So at this point, our recommendation is that we try and figure out every legitimate cost we can between now and December 30th that we can ask for and get it asked for.
Okay. Mary Armstrong has her hand up. Mary, do you want to go ahead and ask your question?
Yeah, thank you. Yeah, I just wondered if anybody received a reimbursement yet for the third cycle, or any interaction with folks at the state. We submitted ours probably about the 22nd or 23rd, and the cycle before I got lots of questions and calls, but I haven't heard anything from the state on this one.
So there are a handful that have been approved. They are working through them. Anticipate that when you get next in line, that they probably will reach out. Unless they don't have any questions, then they would just approve it and your money would show up. But more than likely, they just haven't gotten to you on the list yet, Mary. I do know that they got considerably more requests than they had gotten in the prior cycles this time. So they're a little inundated and trying to play catch up a little bit. But trust me, they're working on them.
Great, thank you.
It looks like Sweetgrass County received theirs after lots of questions and adjustments that they had made to it. So that might be a good reference point for you. Jason and Eric, what about renting a vehicle for use if purchasing one might be an issue? Is that an eligible expense?
It's COVID related, yes.
Okay. And so December payroll won't be reimbursable, as your period end date for payroll is December 31. Is that true?
So everything through December 30th will be reimbursable. Costs incurred, and then you will make the ask through that payroll, through that date of payroll in your January request.
Okay. Diane McLean, your line is open if you would like to ask your question.
So can you hear me?
Yes.
Okay. Our health department purchased 10 cell phones through a COVID grant that they got for the extra contact tracers that they've got helping. And so I'm wondering if when they use that COVID money already, if that's something we're going to put into an application, or if that's, I mean, that looks like double dipping to me.
Correct. That would be, you would not be able to use CARES Act to again pay for those cell phones if you used
Okay.
a different source.
Okay, thank you. So is there going to be, I'm sorry, I was a little bit late getting joined. I had a heck of a time getting on this morning. I'm not sure from my home computer. Is there going to be an opportunity to finish that cycle up in January? Is that what I heard you say about December's payroll?
Yeah, so all of your expenses incurred through December 30th, payroll included, you will put on your January request. So if you cut checks for payroll on January 3rd, you're still going to get reimbursed for your payroll through December 30th.
Okay.
So you'll have to do some internal math if your pay period doesn't end on December 30th, and I doubt it does. You'll have to subtract off the 31st, 1st, 2nd, 3rd, but
okay. So ours is a once a month payroll, so I'm thinking the only day that won't count is December 31st.
Correct.
Okay. And when is the next opportunity to put in, like, we got put in through August, so for November, September and October and November, when is the next application time period that we can put in?
So it will be in November for all expenses incurred and paid through October.
Okay.
So, starting November 1st, you can begin to gather your expenses again for back as far as March.
Okay.
Anticipate that they will open the portal sometime late that first week of November.
Okay.
Quote me on that because that's been a little bit fluid. So anticipate somewhere around Friday the 6th that the portal opens.
Okay.
And I anticipate that they will close it somewhere around the 20th.
And when I go back in and check, it says that my last application was accepted or submitted, but I have not heard anything or received any email or any kind of notification. Is that normal?
So correct, that is normal. They will work through it. And when they get to you, anticipate that they will have questions.
Okay, thank you.
Those that have been approved, I think have seen that the cycle is very similar and that they'll have a bunch of questions and ask follow-up, etc. And I think they're just working through them one at a time.
Thank you.
And you were on the list of submittals, and so I know they have it.
All right. Let's see, do we have any? I don't see any other hands up right now. I think we're caught up in the chat. So if you have any last minute questions, ask now. Otherwise, we'll toss it back to Jason, Eric, see if you guys have anything else you want to add. Oh, Keith says, here's my 2 cents on revenue recognition for the presumptively eligible payroll portion. Salaries and wages plus FICA should be recognized in FY 2020. The change to include benefits came after June 30 and is non-recognized subsequent event, even though the change was retroactive in FY 2020. The fringe benefits will all be FY 2021. Do you agree with all of that?
I think that you would have a reasonable argument for that.
Okay.
But I haven't had much luck seeing eye to eye with the auditors on this. The county attorney software is called Carpel. Karpel. I think Eric typed it in up the chat a little ways. Yeah. And I will type it in again.
Jason, there's another question here about what about paid time off? Treasury regulation issued on September 2nd specifically includes paid time off as eligible. Any progress in getting the state to approve this?
They are a hard no. They simply philosophically disagree with that guidance and have decided they are not going to pay for any type of leave. So bereavement, administrative leave, vacation, sick time, they have deemed it that they're not going to pay that out. And I haven't seen, and Eric could step in too if he wants, but I haven't seen any wiggle room from them on it. It's all.
None. There is no wiggle room.
Okay.
Jason, this is Roman again. Unless there's another hand in front of me. So the question of paid time off. So do you recommend for our sheriff's office example, if a deputy has to take time off due to being quarantined, named a close contact or what have you, then we probably, if we're going to get reimbursed, because that's directly because of COVID, why he cannot work, he's at home, he should be putting on his time card regular pay and just make note due to quarantine COVID, or should he use sick leave and get quarantine reimbursement?
So now you're getting more into the human resources side of things. I will tell you that if they're not working, whether they write down sick leave or quarantine or whatever, if they're on leave, paid administrative or otherwise, it's not CARES Act reimbursable.
Wow, even though because he wants to be at work and we want him at work, it's creating a hardship for the shift coverage. It's all because of this corona thing and he's not supposed to be spreading it, so he has to stay home for 14 days.
Administrative leave, sick leave, not eligible.
Okay.
So, Roman, where you can get some consideration for situations like that is the overtime that you pay for your other deputies to be able to cover his shifts or bring in additional staff if necessary. Okay. Those costs are reimbursable, but your pay to anybody out on leave for any way, shape, or form, and this is not the state, this is Treasury. They've just made an exception for all public sector employees that you're not going to get reimbursed for leave time. And if Mackenzie's on, maybe she can confirm what we're saying, and if not, right.
Okay.
Not seeing Mackenzie. All right. Eric, I have a question that came into me private to pass on. It says, Eric, will you reiterate how funding is able to be spent? Sorry, I know you've said it a bunch of times.
I was reading the chat line. Was that to me?
No, it's a private one to me, but it's addressed to you.
Okay. And the question is, how do we think the money can be spent?
Will you reiterate how funding is able to be spent?
Yeah. So the money coming back in this program should come into that federally identified $29.99 revenue account, right? And that the state set that up so you could have essentially so they could have easy tracking when they're subject to the audit provisions of CARES Act. The state is the only entity directly responsible to the U.S. Treasury for compliance with the eligible expenditures in CARES. Because they set up a reimbursement program, all the money that they're sending off to the counties will pass muster according to them, and they're responsible if they've done any distribution of funds to local governments that aren't CARES Act eligible. So once you get the money, you have cleared all the obstacles for allowable uses because the state put that provision in there. Thus, I believe the money, once you get it into that fund, is able to be transferred into your general fund to be used for general governmental purposes. It does not have strings attached. It does not act as grant money. It does not have to be categorized in such, and it does not have to go back to pay the fund that the expenditure came from. That is what I believe. That is what our national association believes. That's what our other states believe. That's the issue that we're trying to get the external auditors in Montana to understand. So if you need the money, transfer it to your general fund and use it for general governmental purposes, knowing that your auditors might write you a footnote or a disclosure statement saying that you were supposed to have credited the expenditure account in your subsequent audit. That's the worst I believe they can do. If you don't need the money, hold it in that federal revenue account until we get further clarity, because I don't want I'm trying not to encourage anybody to get any audit findings or write-ups. But until we get further clarity from both the state and from the external auditors about how we're supposed to be handling this, keep it in that federal revenue account for right now. If you need it, use it. If you don't, hold it there.
Yeah. And we just want to be transparent that, you know, we're in disagreement with the auditors, but we don't do the audits. So, you know, the decisions you make in the end, if we don't come to an agreement with them, we're trying to let you know what the possible consequences might be. I see a question here on Roman's example. Mackenzie can't unmute, but so whether or not you have to give them leave based on EPSL, et cetera, is a different question than whether that if you pay them while they're on leave is CARES Act eligible. I'm only referring to the fact that CARES Act will not reimburse that leave time.
Let me try here. Mackenzie, can you talk now?
I think so. Can you hear me?
There you are. Yep.
Yay. Sorry, I don't ever use this platform. I'm used to Zoom. So the FMLA has been expanded in response to the pandemic, and it's called the Families First Corona Response Act, I think. And that's why it's not CARES eligible, because it's covered under that. Unfortunately, local governments are excluded from reimbursement under that act, but you still have to provide the leave. So you have to provide 80 hours for the first 6 reasons, and then there's additional 10 hours of leave available for the loss of childcare if a person is unable to work or telework because of the COVID-19 related event. And that's at 2/3 salary. So there is a leave option. It's just not part of CARES Act.
Thank you, Mackenzie.
Yeah, and it is complicated. So if anybody has any questions, please just email me.
Okay, great. And what's your email address?
You want me to type it in the chat? That's probably easier.
Actually, if you'll do both, the chat doesn't come with the recording.
Oh, okay. It's mmccarthy@mtcounties.org.
Great. Thank you.
Mm-hmm.
All right. Get her shut off there. Okay. I see no more hands. I did have a question about sharing the chat related to the audit issue so that they can show that to their auditors. Does that seem like it would be a good option for folks if they had access to that? Jason, what do you think about that?
I don't have any objection to that. We're happy to also have a conversation with the auditors to try and, you know, continue the dialogue to find common ground or come to an understanding of what this is and why we disagree with them. We have spoken with one auditor who does quite a few counties, but we certainly have not spoken to them all. I have heard that there, at least in one instance, where an auditor sort of has seen, maybe not the rationale, but has seen the way that you might get around it, and has found a little bit of a gray area. So I think we're starting to gain some ground, but happy to have a conversation with them would probably be the best thing, assuming it's not the same one we've already had a conversation with.
Ashley, let me add to that. I think because of the technical expertise we have across the state on what I think we could come up with in terms of best practices for recording these unique one-time only revenues, I'd ask for us, the folks on this call and our membership, to put together something that looks like best practices both in how to record the money coming in, whether you're going to backdate it to FY20 or accrue it or allocate it all to FY21 as unexpected, and how you think that money should get back into your general fund. Because remember, your external auditors are only auditing for compliance based on what the state says, controlled by Local Government Services Bureau, Department of Administration. So if we can tell them the way it should be, and we can convince the state to accept that that's the way that it should be, then we can make our auditors audit it that way.
Okay. All right. Any other thoughts or questions? It looks like we're about 11:45 now, so I want to make sure that we're respectful of everybody's time. But if you have anything else you'd like to throw out there, now is it. Otherwise, we will have some parting words from Jason or Eric or Dan? Like I said, that best practice guidance would be most helpful ASAP.
Yeah, I don't have anything else to add. It's been a good discussion. I hope it's been useful for everyone.
Scott, do I have your email? Okay, yeah, I do.
Great. All right. Anything else for the good of the order? Okay. Well, and Dan, you want to shut us down?
Yeah, well, again, thank you, everyone. We anticipate hosting another one of these in 2 weeks, unless something else comes up. But we're glad you were able to join us today, and appreciate all the work that you're doing on behalf of the citizens of your counties and the work that you're doing across the state. I don't think this system would work if it weren't for your dedication. So I appreciate those efforts. And with that, I guess we'll go ahead and close off this session until a couple weeks from now. And if you have any other continued questions, please contact Mako or our office. We'll be happy to help or assist you in any way we can. So be
30th
safe.
at 11?
Go ahead.
30th at 11, is that our plan?
That's what I was thinking, the 30th. Yeah.
So watch for an email from Mackenzie or from Chantel, and we'll post the recording of this session and on our website, and also send it over to Chantel so the Mako site can have it. So share with anybody you think needs to hear it, and we will get that invite out for the 30th at 11 for the next meeting. Thanks, everybody. Have a great afternoon.
Stay safe out there.